Medication routes of administration.
For the purpose, it is done to provide a medication the client requires. To begin with the assessment, assess the client allergies to medications, specific drug use, client's knowledge and learning needs about the medications, tissue integrity of the selected site, client's age and weight to determine site and needle size, and client's ability to participate. Determine whether the size of the muscle is appropriate to the amount of medication to be injected. Moving forward to the planning, the needed equipment are as follows: client's MAR, sterile medication, syringe, and needle of appropriate size and type, antiseptic swab, and clean gloves. Continue with the implementation. First, under preparation, check the MAR. Check the label on the ampule carefully against the MAR to make sure that correct medication is being prepared. The label when medication is taken from the cart, before withdrawing and after withdrawing it. Second is organize the equipment. To begin with the performance, perform hand hygiene and appropriate infection prevention procedures.
Step 2. Prepare the medication from the vial or ampule for drug withdrawal. Whether feasible, change the needle on the syringe before the injection. For the rationale, because the outside of a new needle is free of medication, it does not irritate subcutaneous tissue. Invert the syringe needle uppermost and expel all excess air. Number 3 is provide for client privacy. So I already closed the curtains and the door. Number 4 is prepare the client prior to performing the procedure. Introduce yourself and verify the client's identity using agency protocol. For the rationale, this ensures that the right client receives the right medication. Assist the client depending on the chosen site. For the rationale, appropriate positioning promotes relaxation for the target muscle. Obtain assistance in holding an uncooperative client. For the rationale, this prevents injury due to sudden movement after needle insertion. Step 5 is explain to the purpose of the medication and how it will help using the language that the client can understand. For the rationale, information can facilitate acceptance and compliance to the therapy. Number 7 is select and locate and clean the site. Select and site for the skin lesion, tenderness, swelling or inflammation, and one that has not been used frequently. If injections are to be frequent, avoid using the same site twice in a row. For the rationale, this reduces the discomfort of IM injections. Locate the exact site for the injection, then apply clean gloves. Clean the site with an antiseptic swab using a circular motion. Start at the center, moving outward. For the rationale, this prevents entry of bacteria into the injection site.
Step 7. Prepare the syringe for the infection. First, remove the needle cover and avoid contaminating it. Then, if using a pre-filled unit dose medication and dripping occurs, change the needle. For the rationale, the medication on the needle may cause pain to the subcutaneous tissues. Step 8. Inject the medication using the Z-Track method. So first, using the ulnar side of your non-dominant hand, pull the skin approximately 1 inch to the side. For the rationale, pulling the skin makes it firmer and facilitates easier needle insertion. Next, hold the syringe like a pen and then pierce the skin steadily and smoothly at a 90-degree angle. For the rationale, quick motion reduces client's discomfort and also holding it like a pen reduces the chance of accidental pushing of the plunger. Next, hold the barrel of the syringe. Then aspirate by pulling back with your dominant hand. Aspirate for 5 to 10 seconds. For the rationale, if the needle is or entered a small blood vessel, it takes time for the blood to appear. If blood appears, withdraw the needle, then discard the syringe. Then prepare a new medication or injection. For the rationale, this determines whether the needle enters a blood vessel. However, if blood does not appear, inject the infection steadily and quickly, approximately 10 seconds per milliliter. For the rationale, injecting slowly promotes comfort of the client and also allows the tissues to expand and absorb the medication. Step 9, withdraw the needle. So, withdraw the needle smoothly at the same angle it was inserted. For the rationale, this minimizes tissue injury. Next, we have to release the skin and then put pressure on the site with a cotton. So, for the rationale, a use of alcohol swab may cause burning sensation to the client. So, next, do not massage the area because this may cause leakage of the medication. Step 10, activate the needle safety device and discard the attached syringe to the proper receptacle. Step 11, remove and discard gloves. And then, perform hand hygiene. Step 12, document all relevant information, the time, the date, the route, the dose, and reactions. Step 13, assess the effectiveness of the medication at the time it is expected to act. Lastly, for evaluation, conduct appropriate follow-up, compare to previous findings, and report any significant deviation from normal to primary health provider. Going to insert 1, 2, 3.
Chill, chill, Beth. Chill, chill, chill.
No blood. So, wait for a few seconds.
Administering an intradermal injection. The purpose of this is to provide a medication that the client requires for allergy testing and TB screening. For the assessment, assess for appearance of injection site, assess for specific drug, action and expected response, assess for client's knowledge of drug, action and response, check agency protocol about sites to use for skin tests. For the equipment that we will need, client's MAR or computer printout, vial or ampule of the correct medication, sterile 1 ml syringe calibrated into hundreds of milliliter, alcohol swabs, 2x2 sterile gauze square, clean gloves, bandage,
epinephrine on hand in case allergic of anaphylactic reaction.
For the implementation preparation, check the label on the ampule carefully against the MAR to make sure that the correct medication is being prepared. Follow the 3 checks of administering medications. Read the label when it's taken from the medication cart, before withdrawing the medication, after withdrawing the medication, and also organize the equipment.
For the procedure, first we have to perform hand hygiene to prevent the spread of infection, and then prepare the medication from the vial or ampule for drug withdrawal, and then prepare the client. So prior to performing the procedure, we have to introduce ourselves and verify the client's identity. This ensures that the right client receives the right medication, and then explain to the client that the medication will produce a small wheel, sometimes called bleb. So the rationale, information can facilitate acceptance and compliance with the therapy, and then provide the client privacy. Then select a site such as a forearm about hands width above the wrist and 3 or 4 fingers width below the antecubital space. And then avoid using sites that are tender, inflamed, or swollen, and those that have lesions. And then apply gloves as indicated by agency policy. Then clean the skin at the site using a circular motion, starting from the center and widening in the circle outward, and then allow the area to dry thoroughly.
Prepare the syringe for the injection. Remove the needle cap while waiting for the antiseptic to dry. Expel any air bubbles from the syringe. The rationale of this is, though a small amount of air will not harm the tissues, grasp the syringe in your dominant hand close to the hub, holding it between the thumb and forefinger. Hold the needle almost parallel to the skin surface with the bevel of the needle up. The rationale of this is, the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. Next is inject fluid with the non-dominant hand. Pull the skin at the side until it is taut. The rationale of this is taut skin allows for a easier entry of the needle and less discomfort for the client. Next is insert the tip for the needle far enough to place the bevel through the epidermis into the dermis. The outline of the bevel should be visible under the skin surface. Next is stabilize the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheel on skin. The rationale of this is, it verifies that the medication entered the dermis. Withdraw the needle quickly at the same angle at which it was inserted. Activate the needle safety device. Apply bandage if indicated. Next is do not massage the area. Massage can disperse the medication into the tissue or out through the needle insertion site. Dispose the syringe and needle into the sharp container. Do not recap the needle in order to prevent needle stick injuries. Remove and discard gloves. And perform hand hygiene. Circle the injection site with ink to observe the redness or induration or hardening per agency policy. For the documentation, record the testing material, given time, dosage, route site, and nursing assessment. And the evaluation is the client response to the testing substance. The rationale of this is, some medication used in testing may cause allergic reaction. Epinephrine may need to be used. Evaluate the condition of the site in 24 or 48 hours depending on the test measure, the area of redness and induration in milliliters at the largest diameter, and document findings.
Moving forward to the next procedure we're going to perform is the administration of a subcutaneous injection. So the purpose of this procedure is to provide the medication the client requires and to allow slower absorption of the medication compared with either the intramuscular or intravenous route. And for the assessment, we need to assess for allergies to medication, specific drug actions, side effects, and adverse reactions, the client's knowledge and learning needs about the medication, the status and appearance of subcutaneous sites for lesions, erythema, swelling, inflammation, and tissues damage from previous injections. And then lastly, we need to figure out if the client will be able to cooperate with the injection and where it was given before.
Moving forward for the SC injection, first we have planning. So planning, first identify the types of medicine that you will administer to the patient and carefully follow any instruction for use provided with your medicine. When using injection by yourself, be sure you understand how to properly mix and store the medicine. Gently swirl but do not shake the mixed medicine, and prepare an injection only when you are ready to give. And for the evaluation, examine carefully the patient for the positive outcome after you give the right dose or amount of medicine administered to the patient, and must reach the desired outcome for the patient or client safety.
Hello everyone! So next is we're going to show you how to insert IV cannulation in the arm or hand of the patient. IV cannula is a small plastic tube that will allow us to give fluids and medications. First is we have to assess the client if he is allergic to anything or to any medications. Then we have to gather equipment. Equipment needed are the cannula dressing or micropore, alcohol swab, cannula, and the tourniquet.
Now we're going to perform hand hanky and observe infection prevention control. Then prepare the medication from a vial or ampule of sterile medication. Next, position the patient arm, apply the tourniquet, palpate the vein, and then select and locate and clean the site. So clean the site with an alcohol swab starting from the center, moving outward for about 30 seconds. Then allow it to dry. Then prepare the cannula.
Secure the vein from the below. Insert the cannula 10 to 30 degrees.
Hindi pa naman tumutusok. Sige. Tingnan mo nga.
Observe for backflow. Then, withdraw the introducer needle and advance the cannula to the vein. Remove the tourniquet, secure the cannula, then apply cannula dressing or the micropore.
Huwag mo munang tanggalin, may backflow, ibig sabihin. Sige. Tingnan mo nga. Tingnan mo, check mo. Out ka na konti. Yan, o sige. O, push. Huwag mo na ibalik. Sige, ito na i-push mo. Ito i-push mo. Sige. Sige, yan. That's it. natin, may backflow, ibig sabihin, kung pwedeng ganito,
Sa daman to ha.
you see? Open mo na kamay mo na, relax. And then, pwede mo na ikabit sa IV. Okay, alam mo na ninyo,